Hello, my name is Natalie Siegfried, and I'm an emergency medicine physician at Norman Regional Hospital in Norman, Oklahoma, in the emergency department. And I'd like to speak to you today about a retrospective study that my department put together to investigate the incidence of intracranial brain bleeds in geriatric patients in the local population. Every year, 1.3 million visits to the emergency department in the United States alone are for closed head injuries. The geriatric patient population, they account for a vast majority of those. However, there's some conflicting data nationally as to whether or not those patients have a higher incidence of intracranial hemorrhage if they're on blood thinning medications or not. Therefore, we wanted to see how our local patient population stacked up against the national averages. So, to be included in this study, you needed to be greater than the age of 65. You needed to have sustained a ground level mechanical fall, and you needed to come in through the Norman Regional Emergency System. We analyzed the outcomes in these patients, and we compared those who were on blood thinning medications, whether that be 10A, antiplatelet, or warfarin, or a combination of any sort of that, versus those who were not on any blood thinning medications. We did a secondary outcome where we looked at the incidence of patients who are on chronic NSAIDs or those who endorsed chronic alcohol use as to whether or not they might possibly have a higher incidence of an intracranial hemorrhage. What we did was we took data from January to December of 2023 and we collected this data and analyzed it. In our local patient population, 18.5% of patients who met the criteria previously stated had a closed head injury. Of that 18.5% of patients, 62.5% of those were on a blood thinning medication of some sort. So we analyzed the incidence of intracranial hemorrhage in those with a blood thinner versus those without, utilizing a 2-proportion Z-test. Utilizing the 2-proportion Z-test, we evaluated the patients and we found that there was a statistically significant correlation between the use of blood thinning medications and the risk for an intracranial bleed. This was with a 95% confidence interval. Looking at the secondary outcomes of NSAID use, almost 9% of patients who did have an intracranial hemorrhage endorsed chronic NSAID use, and 5.4% of our patients who had an intracranial hemorrhage endorsed chronic alcohol use. I think that those are two very interesting risk factors that would be a very interesting thing to do in the future to possibly evaluate on their own for their own statistical significance. There were some limitations of this study, and sample size was one of them. I do think if we were to recreate the study in the future, utilizing the sample size that we had, I think we should go ahead and increase the months or years that we do the retrospective study, and that would simply fix the small sample size problem that this study had. Another limitation was that we did not delineate between the type of blood thinning medications. In the future, if we were to recreate this study, I do think there would be some value in delineating the patients who had intracranial brain bleeds as to whether or not they were on a 10A inhibitor, warfarin, or an antiplatelet medication. I think that's a very easy thing to overcome if we were to recreate this. While we did want to investigate the local patient population, if we were to recreate the study in the future, we could also include other local hospital systems to further give power to our findings in our study. I'd like to thank you very much for your time today.